At UC Health, all of our providers and staff are focused on ensuring patients receive the very best care and experience. And one important way we can help care for each other and ourselves is through advanced care planning. I've personally seen how important these conversations and documents are.
Advanced care planning is important to everyone. It's a process whereby adults can identify their values and preferences for their future medical care in the event that they can't speak for themselves.
One of the most important advanced directives to complete is completing a medical durable power of attorney, and that's putting down in writing who you want your healthcare advocate to be.
In the state of Colorado, no one is automatically assigned that role. Nobody's going to make decisions for you. Not your spouse, not your significant other, not your child or parent, and not your doctor.
I consider the first step towards advanced care planning having discussions with family and friends, sometimes multiple discussions on an ongoing basis.
Conversations are the best place to start to open the door to these difficult issues, but they have to be documented. One, so our families know, and two, so that the medical providers that will be caring for us know what we want as well.
We have shifted our focus on advanced care planning in our practice to something we talk about at every physical from age 18 on, so that patients understand this is not just something that you do when you are old or sick.
For your family, it is a gift. And instead of hearing the, I wish I would have had these conversations and I wish I would know what to do, that now changes to, I feel more confident that we're doing what my loved one would want.
A well-informed patient is a healthier patient, and advanced care planning is simply a component of that. Being able to understand the patient's viewpoint in as many ways as possible allows us to do a better job of meeting their expectations and providing and delivering the care that they want. Most recently, we've opened up the ability for patients to document their power of attorney or their advanced care planning wishes so that we can see that. And now patients can directly in their portal indicate, I have advanced care wishes, here's what they are, sign it, and that's part of the official record. And it dramatically simplifies the patient's process for getting their wishes known.
We really encourage you to come in and talk with us about advanced care planning. We want to make sure you're prepared. We don't want to wait for times of crisis. We want to make sure that your voice is heard and that you have control.
Advanced care planning helps people at any age or stage of health take charge of their future medical care. Having conversations with loved ones and writing down those wishes are essential. To help our patients and employees have these conversations, UC Health is building new tools in My Health Connection, and we're training teams to support patients and families who are ready to discuss their wishes. I challenge you to make this a priority. Together, we can promote advanced care planning throughout Colorado.